If you want to treat your acid reflux, you first need to figure out what's causing it. And one potential cause is a hiatal hernia. We have the lower esophageal sphincter, which is a muscle at the top of the stomach and the bottom of the esophagus. This muscle is supposed to close tightly, and that prevents the reflux. And a true hiatal hernia is a situation where the stomach protrudes out through the lower esophageal sphincter. So that muscle is not allowed to close, which causes acid to bubble up into the esophagus. Hiatal hernia syndrome is similar, but that stomach is not protruding past the lower esophageal sphincter, but is just putting pressure on the lower esophageal sphincter. One potential solution for a severe hiatal hernia would be surgery, but that is a major surgery, so you'd want to avoid that if you can. But for less severe true hiatal hernias or hiatal hernia syndromes, there's a few tricks you might want to try. One is finding the bottom of your sternum and you press down into the tissue and then press downwards toward your feet. And after running through a few deep breaths, you can release that. This is something that's physically pulling the stomach down and allowing that lower esophageal sphincter to close appropriately. You can do that a couple times a day. And if you can, after that, you can pull your knees up in the chair like this and just pull them against your chest. And finally, you can do heel drops, where you drink a glass of water really quickly, and then you stand up on your toes and drop down to your heels. This is a great practice to do first thing in the morning, but you can also do it a couple times throughout the day. So you drink your 12 ounces of water to essentially put weight in your stomach, and then you stand up and do those drops about 10 times. Just like that. Nothing too hard, about 10 of those, and that will again help to physically pull the stomach back down out through the lower esophageal sphincter so it can close, and hopefully that reflux starts to get better.